Hello everyone, today's topic is mammary gland. Mammary gland, it is an exocrine gland which is a sweat gland of apocrine variety. So it is a modified sweat gland of apocrine variety and it is present in both sexes. But it is rudimentary in males. On rare occasions, the breast of male become enlarged. This condition is called as gynecomastia. Mammary glands are developed in females after puberty and forms an important accessory organ in female reproductive system. So this structure has high surgical importance. So it is important to know its normal anatomy. So let's see the location of mammary gland. So if we see here in this image, the mammary gland is located within the superficial fascia. So it is located in the superficial fascia. So we can see here. It is located in the pectoral region, that is superficial fascia of pectoral region. However, a small extension from its anterolateral aspect is called as axillary tail of Spence. So we can see a small projection of it and where the superolateral part of it into the axilla, which is called as axillary tail of Spence. So this axillary tail of Spence pierces the deep fascia and extends into the axilla. So the aperture where it pierces into the deep fascia, this aperture is called as foramen of Langer. So it is called foramen of Langer. The axillary tail is the site of high percentage of breast tumor. So let's talk about the extent of the mammary gland. It extends from the 2nd to 6th rib vertically. So vertically we can see here, this is 2nd rib. And below it extends till 6th rib. So it extends vertically from 2nd to 6th rib. And if we see its horizontal disposition, it is related to the lateral border. So it extends from the lateral border of the sternum to the mid-axillary line. So here is the lateral border of sternum. And till the mid-axillary line. So if we draw a line vertically down from axilla. So that is about the extent and axillary tail of Spence. So we have seen about the extent of mammary gland. Now let's see the relations. So the deep aspect of the breast, it is related from outside inwards to pectoral fascia. So breast rests upon pectoral fascia, which is the deep fascia covering the pectoral region. Here is and deep to pectoral fascia, there are 3 muscles. Pectoralis major muscle, so we can see the muscular relations in this image. It is related to pectoralis major, medial 2/3. So this is pectoralis major. So medial 2/3 of pectoralis major. And it is related to serratus anterior. So lateral 1/3 is related to serratus anterior. And it is also related to external oblique, which is present on the inferomedial quadrant. So this is. So we can see the 3 muscles, how they are related. So the mammary gland, medial 2/3 of the mammary gland, posteriorly it is related to pectoralis major muscle. Then lateral 1/3 is related to serratus anterior muscle. And inferomedial quadrant means this part, inferomedial quadrant of the mammary gland is related to external oblique muscle. Retromammary space means the mammary gland is separated from the pectoral region by a space called as retromammary space. So here this is pectoralis major muscle, and here is the mammary gland, and we can see the other muscles deeper to pectoralis major. This is clavicle. Beneath the clavicle, subclavius. We can also appreciate pectoralis minor, which is present deep to pectoralis major, and the fascia here is the clavipectoral fascia. And these are ribs along with the intercostal spaces. So this gap, which is in superficial to pectoral fascia, is retromammary space. So retromammary space, it contains loose areolar tissue which is intervening between the base of the breast and the deep fascia. So here is the base of the breast, and this green lining is the pectoral fascia, which is the deep fascia. So this retromammary space, as it is filled with the loose areolar tissue, this allows the breast to move freely over pectoralis major muscle. Normal breast, they move freely because of retromammary space. They move freely over the pectoralis major muscle. Let's see the structure of mammary gland. It consists of three structures: skin, stroma or connective tissue, and the third component is the parenchyma or glandular tissue. So that is, those are the three components which are present inside the mammary gland. And let's see the skin first. So the skin, it is identified by the nipple. Nipple is a small conical projection which is present below the center of breast. It is most important surface feature of pectoral region. Its position varies considerably in females, but in males it is usually lies in fourth intercostal space. So in males it lies in fourth intercostal space, just medial to mid-clavicular line, or we can say 10 centimeters away from the midline. So from the median line crossing the sternum, so away from the midline, we can calculate as 10 centimeters lateral to it in fourth intercostal space is the position of nipple. So nipple is pierced by 15 to 20 lactiferous ducts. So here we can see the ducts, small ducts which are opening in the nipple, which are called as lactiferous ducts. And it contains circular and longitudinal smooth muscles. Circular muscle erects the nipple and longitudinal muscle relaxes the nipple. And nipple is rich in nerve supply and provided with sensory receptors for suckling. So next important feature around the nipple is the areola, which is present in the skin. Areola is a pigmented circular area of the skin around the base of the nipple. So this is areola. So it is a pigmented circular area which is present around the base of the nipple, and it is rich in modified sebaceous glands which are present at its outer margin. And these modified sebaceous glands, they get enlarged during pregnancy and lactation, which are known as tubercles of Montgomery. So areola identified by tubercles of Montgomery. So tubercles of Montgomery are the modified sebaceous glands which gets enlarged during pregnancy and lactation. So these tubercles of Montgomery, they are concerned with the production of oil. So oily secretions which lubricates the nipple and the areola. And this areola also contains the sweat glands and accessory mammary glands. And the skin of this nipple and the areola is devoid of hair and fat. So these two areas are devoid of hair and fat. So that is about the nipple and the areola, and the rest of the skin is the normal skin which is present usually elsewhere in the body. Next we shall discuss about the stroma of the breast. The stroma of the breast consists of connective tissue and fat. So what we are seeing, these yellow color structures are all fat, which is the adipose tissue, and intervening between the fat we can see the connective tissue. This is the connective tissue. So connective tissue plus fat makes the stroma. So this stroma, it forms the supporting framework of the breast. So the connective tissue, it condenses to form a fibrous strands or septa which anchors the parenchyma to overlying skin called as suspensory ligaments. So we can see the connective tissue which connects the skin. So the connective tissue, we can see it gets condensed and it forms fibrous strands or septa which anchors the parenchyma to overlying skin. So we can see this septa. So these septa are the suspensory ligaments of Cooper. Then fatty stroma, that is the adipose tissue, forms the male bulk of the gland and it is distributed all over the breast except beneath the areola and nipple. Next, about the parenchyma or the glandular tissue. If you see the parenchyma, it is made up of compound tubulo-alveolar gland. So parenchyma is composed of this compound tubulo-alveolar gland which secretes the milk to feed the newborn. And the gland consists of 15 to 20 such lobules. So if you see, we can see here, these are the lobules. So there are around 15 to 20 lobules in each mammary gland, and these lobules, they are arranged in the radial fashion just like a spokes of a wheel. So here in this image we can appreciate very well the parenchyma or the glandular tissue, and we can see these tubulo-alveolar glands, they are arranged radially, which are arranged like spokes of a wheel. So I am marking one or two lobules, and these lobules we can see they are separated by the fibrous septa which are the suspensory ligaments. We can see here, these are the fibrous septa which anchors the mammary gland. So if you consider each lobe, there are 15 to 20 lobes. So if you consider each lobe, it consists of clusters of alveoli. So each lobe made up of alveoli, and these alveoli are drained by the lactiferous ducts. So we can identify the lactiferous ducts. So let's observe these lactiferous ducts. These lactiferous ducts, before their termination, they form a small dilatations which are called as lactiferous sinuses. So you can see here. So these lactiferous sinuses are reservoirs of milk during lactation, and ducts finally open into the nipple. So that was about the structure of the mammary gland. Here is a schematic image where the blood supply of mammary gland. We can see the perforating branches supplying from the medial side of the mammary gland. which are the branches of internal mammary artery or internal thoracic artery. And we can see from above 3 branches of axillary artery, that acromiothoracic artery, superior thoracic artery, and lateral thoracic artery. So these 3 are the branches of axillary artery. And we can see the branches of posterior intercostal arteries, which supply on the lateral aspect of the mammary gland. Venous drainage. Venous circle beneath the areola, it forms the plexus, and the veins from these plexus run in the superficial and deep sets. Superficial veins drain into internal thoracic vein. So, this is the vein which is run along with the corresponding artery, that is, it is along with the internal thoracic artery. So, superficial veins drain into internal thoracic vein and superficial veins of the lower part of the neck. And whereas the deep veins, they drain into axillary vein and posterior intercostal veins, which further drain into azygos venous system. So all these veins, they follow the arteries, so they are named same as arteries. Metastasis of breast carcinoma to the brain may occur by the following route, like cancer cells enter into the intercostal veins. Via the intercostal veins, the cells enter into the external vertebral venous plexus and they further enter into internal vertebral venous plexus, which are called as Batson's plexus, present around the spinal cord, and further drain into the cancer cells into cranial dural sinuses. So that's how the cancer spread into the nervous system. Lymphatic drainage of mammary gland. The knowledge of lymphatic drainage of the breast is of great clinical importance due to high percentage of occurrence of cancer in the breast and its subsequent spreading of cancer cells, that is metastasis, along the lymph vessels to the regional lymph nodes. So let's talk about lymph nodes of mammary gland. So the first set are the axillary lymph nodes, which are the chief lymph nodes of mammary gland, which are further divided into 4 groups. So axillary lymph nodes are divided into 4 groups. Anterior group, which is otherwise called pectoral group. Next is posterior or subscapular group. Next is the central group. Here are the lateral groups. Then apical. So these 5 groups together called as axillary lymph nodes. So lateral group otherwise called as humeral group. The other lymph nodes which the mammary gland drains into are the internal mammary nodes. Internal mammary nodes are present along the internal thoracic vessels. Supraclavicular nodes and infraclavicular nodes, which are present above and below the clavicle respectively. Show with a different color. Supra and infraclavicular nodes. Posterior intercostal nodes, which lie on the posterior aspect part of the intercostal space, which are present in front of the heads of the ribs. And there are nodes which are called as subdiaphragmatic and subperitoneal nodes. Subdiaphragmatic and subperitoneal nodes are usually present below the diaphragm. So these are the lymph node groups where the mammary gland drains into. So further, the lymphatics can be classified into two types: superficial lymphatics and deeper lymphatics. Superficial lymphatics drain the skin of the breast except that of nipple and areola, whereas the deep lymphatics drain the parenchyma of the breast and the skin of the nipple and areola. The plexus of lymph vessels deep to the areola are called as subareolar plexus of Ceppi. So the subareolar plexus of Ceppi and the most of the lymph from the breast, they drain into the anterior group of axillary lymph nodes. So these are the superficial lymphatics of the breast of one side communicate with those of the opposite side. Consequently, the unilateral malignancy may become bilateral. So we can see here the internal mammary nodes, they cross towards the opposite side. So here we can see the communication of lymphatics from one side to the opposite side. The lymphatic drainage from the mammary gland occurs into four quadrants. So we can divide schematically the mammary gland into four quadrants: upper, lower, lateral and medial. So here upper medial, this is lower medial, upper lateral and lower lateral quadrants. So the lymph from the lateral quadrants of the breast drained into anterior axillary lymph nodes or pectoral group of lymph nodes. So we can see here they are draining into So the lymph from the lateral quadrants we saw they are draining into anterior axillary and pectoral group of lymph nodes. These lymph nodes are situated deep to the lower border of pectoralis minor muscle. The lymph from the medial quadrants is drained into internal mammary lymph nodes. So all these are So the lymph from the medial quadrant is drained into internal mammary lymph nodes which are situated along the internal mammary vessels, and some lymphatics may go into internal mammary lymph nodes of opposite side as I shown in earlier. So a few lymph vessels from the lower lateral quadrant of the breast follow the posterior intercostal arteries and drain into posterior intercostal nodes. So we saw that lower lateral quadrant drains into posterior intercostal nodes. A few lymph vessels from the lower medial quadrant of the mammary gland pierce the anterior abdominal wall and communicate with the subdiaphragmatic and subperitoneal lymph nodes. So subdiaphragmatic and subperitoneal lymph plexus it communicates. So the lymph vessels from the deep surface of the breast pierce the pectoralis major and clavipectoral fascia to drain into apical group of lymph nodes. So this is how the lymphatic drainage of mammary gland occurs. So some important points to note: 75% of the lymph drains into axillary lymph nodes That is the reason axillary lymph nodes are considered as the chief lymph nodes of mammary gland. So mostly among the axillary lymph nodes, we can say mostly the lymph is received by anterior group and partly by the posterior group to lateral and central group. Finally, the lymph is drained into apical group and from the apical group to the supraclavicular lymph nodes. And 20% of the mammary gland lymph is drained into internal mammary lymph nodes and 5% drains into posterior intercostal group of lymph nodes. So among the axillary lymph nodes, most of the lymph drains into anterior axillary nodes and remaining into posterior and apical groups. So this is about the lymphatic drainage. And one more point to note is about the sentinel lymph node. Sentinel is the first lymph node or the group of lymph nodes to which the cancer cells are likely to spread from the primary tumor. After blood supply, lymphatic drainage, let's talk about the nerve supply of mammary gland. The nerve supply are chiefly by anterior and lateral branches of 4th to 6th intercostal nerves. So these are the anterior branches. And we can also appreciate lateral branches in this image. So here we can see in this image the anterior branches and lateral branches. They are the branches of 4th to 6th intercostal nerves. So that is about the nerve supply of mammary gland. Applied anatomy or clinical correlation of mammary gland. So breast cancer or carcinoma of breast. It is one of the most important common cancers in the females. It arises from the epithelial cells of the lactiferous ducts. And in about 60% of the cases, it occurs in the upper lateral quadrant and commonly affects females between 40 to 60 years of age. And clinically it presents presence of painless hard lump and breast becomes fixed and immobile due to the infiltration of suspensory ligaments and retraction of the skin due to the infiltration of suspensory ligaments, and also it is identified by retraction of nipple due to the infiltration and the fibrosis of lactiferous ducts. So cancer cells may infiltrate the suspensory ligament and breast becomes fixed. So contraction of ligaments produce retraction of the skin. The next appearance is Waddy-Orange syndrome. So Waddy-Orange syndrome is the obstruction of superficial lymphatics which produce edema of the skin, giving rise to an appearance of a skin of an orange. So it is called Waddy-Orange syndrome. On rare occasions, cancer cells from the subperitoneal plexus undergo transcoelomic migration and produces secondary deposit on ovary forming Krukenberg tumor. Radical mastectomy. So removal of complete breast along with the axillary lymph nodes and pectoralis major and minor muscle is called as radical mastectomy. So during surgery of mammary gland, radial incisions should be put to avoid the damaging of lactiferous ducts. The other clinical correlations are amastia, means bilateral agenesis or absence of mammary gland is called amastia. Polythelia, means supernumerary nipples is called as polythelia. Gynecomastia, means development of breast in males is called as gynecomastia, and it is a characteristic feature in Klinefelter syndrome. In Klinefelter syndrome, the chromosomal complement is 47XXY. So they have one more extra X which is called 47XXY. So which is identified by gynecomastia. So this completes the clinical correlation. normal anatomy of mammary gland. Thank you.